Thank you for joining me on the phases of psychological rehab from sports injury. This is a topic that I've been very passionate about for some time, mainly because of some own struggles I had in my own athletic career. I had a shoulder injury my junior year of playing baseball at LSU, and at the time it was thought to be tendonitis in my shoulder, and it may have been. This was back in 1992 in the fall. I had just gone through a lot of growth and development as a player, and I was very excited about the progress I was making. And woke up the next morning after an inter-squad game and really struggled to comb my hair and couldn't get my hand up to my head. I had much better hair back then, and it was pretty long, but I couldn't comb my hair, and I felt the pain in the front of my shoulder. And I did the traditional rest rehabilitation. And at the time, the psychological aspect of injury was a little bit more difficult from the stance of you get isolated from your team, and we used to have to go do rehab at 5:30 in the morning in the football training office. And it was a unique experience because at that time you had to put on clothes specifically for rehab. And the clothes were American Red Cross shirt and American Red Cross, I say American Red Cross, it was a big red cross with a number on it on your shirt and on your shorts. You weren't allowed to participate in team activities unless you were fully attending rehab at that early in the morning. So as a college student, 5:30, 6 a.m. Rehabilitation is not the most enjoyable time. But to be branded as an injured athlete, I think was another step and probably contributed, probably not really understanding the stigma side of things, but it was not the best experience as a student athlete to be deemed as one of the injured ones. I've seen an amazing transformation of treating and working and rehabbing injured athletes, as well as the general wellness that we use in student athletes in the college level all the way down to high school. Obviously, the professional world has a different mindset in the sense of many of the professional athletes have their own care team that takes care of them. And if I was playing for multi-million dollars a year, I would have my own rehabilitation and strength conditioning and massage and all the other factors that go with it. But you're seeing that boiling down into the colleges where athletes are spending more time on the table, not necessarily for time loss injury, but for strengthening, building up, and helping in the recovery process. So I got into the psychology of injury because of my own struggles. I struggled for about a year afterwards, and I lost my mechanics as a pitcher, which is a very dramatic and troublesome feeling. I lost my confidence, and I felt like I had missed my opportunity. It wasn't until I turned to the mental side of the game going into my fourth year, so it was about a year later, and then I realized that I had to do with what I could to help develop the only game that I had. So during my training as a clinical psychologist, I specialized in physical medicine and rehabilitation, chronic pain and health condition management, and also looking at things like depression and anxiety within the medical spectrum. So it's a very big passion of mine. It's a core of where I work, particularly in organizations to this day. And I hope you find this webinar helpful into your practice. So what I want to talk about today is a couple things. I want to look at some of the key contributors we see to actually injury, which I know seems strange, but I'm going to go into some thoughts on that. I want to look at some of the psychological factors that can help predict and also drive recovery. I'm not a big fan of rehabilitation. I will use the terminology because it's an old habit. I don't like rehab because I don't like players trying to get back to what they once were. I'd rather see them recover and rebuild and build to a much stronger function and help them realize the success that they can have can help far exceed what they were prior to the injury if they buy into the process for many of them. Then we're going to dive into the reason you're here, which are the 5 psychological phases of injury rehab, and then the role you play in your athlete's recovery. So it's going to be a fun discussion, so let's get started. So real quick, a little bonus to you for this free webinar. If you stick around to the end, there's a PDF of the biopsychosocial model of health behavior. And this is obviously adapted from many years of research and understanding within the clinical psychology and many other the health behavior programs. It's a core function of what I work on from a psychologist standpoint, looking at the multi-dimensional factors of an athlete to put together the psychological understanding. So those biological factors that we look at, like genetics, sports specific or medical histories, looking at psychological screenings and limitations, and then what I always look for is the parental athletic history. Then the psychological factors, things like motivation, what their vision is for the future, their self-efficacy, do they believe they can succeed or not, how they handle pressure and how it breaks into their psychological coping mechanisms, and then the social factors, how they accept responsibility and how they accept coaching. Do they work with you as the athletic trainer or the treatment staff, to make it a collaborative versus a maybe adversarial relationship? My dissertation was on adherence and adherence to a free medication program, which was interesting because people say all the time the number one barrier for taking medication is, I can't afford it. Well, I was fortunate enough to study a medication program where the medicine was given to the patients for free for 2 years, and it didn't increase adherence rates 1%. So there's many other factors that have to go into why a patient, a student athlete, even a motivated student athlete, would get highly engaged and ready to compete in an environment where many times the pressures are there to compete at the highest. So why are they resisting treatment? So let's dig in a little bit about me. All right, I am a clinical and a sports psychologist. I've been working with athletes primarily for the last 10 years. 100% of my practice is devoted towards performance, and I work on both the clinical and the overall performance mind. For many folks in my field, we may have one focus or another. I believe that my clinical background helps me understand the full spectrum of the human athlete and the overall treatment team. I think one of the values that I bring as a clinical psychologist is I'm trained in the world of what we call behavioral medicine, which is the multidisciplinary approach to helping patients' wellness and the medical and psychological factor. I've been integrated with teams my entire career, whether it's a physician staff, nursing staff, rehabilitation staff, hospital administrators, to athletic departments and working with head coaches, general managers, team operations personnel, to athletic trainers, strength and conditioning staff, team physicians, and the like. And it's being sometimes the center of that spoke to help communicate across many different realms. I'm fortunate enough to be at some pretty good spots. I do a lot of work in the college spectrum. I'm a sports psychologist for the University of Alabama. What I'm sharing here tonight is not any insight to what they do there, and I'm not going to do that, or my views are not reflected upon them, but this is some skills that I do bring to the table there. And I'm a presenter and active with the Andrews Sports Medicine Institute in Birmingham, Alabama. And I do a lot of work with my professional athletes on the professional golf realm, but I have worked with NFL teams, NBA teams, and athletes across pretty much every major sport there is, particularly if they've been injured. This is a specialty of mine that I really enjoy working in, because there's nothing better than seeing an athlete return to function and to be able to achieve what many times they fear. So let's take a look a little bit at the field of sports psychology and mental coaching. I think this is always important when we talk about the field of mental coaching. Has a wide variety of expertise and a lot of contributors in the field, and it makes the space kind of unique. In one realm, if we look at it as a continuum, we have former players or coaches or people who have focused on the mindset and come at it from a motivational perspective. And many times these are individuals who have applied experience, may not have the educational background, but they have some great value of helping people see through maybe the clutter, or see through because they've been there, they've walked that walk, they know what it takes, and they can provide valuable insight to an athlete going through a rehabilitative course. I love pairing athletes with somebody who's also gone through the very similar injury but have been able to return to function. So within the mental space, you may see some of those providers that are mental coaches or mindset coaches who have a very valuable experience, but you always have to be aware of boundaries and limits of expertise. And so many times those individuals don't have the understanding or the clinical training to know what level feeling down is versus depression or an underlying psychological issue that's manifesting during an injury. So you see people who have training in sports psych. They have either a master's degree or a PhD in sports psychology, and they get exposure and understanding of some of the human experience and the conditions and some clinical assessment to be able to screen out but not treat. And then you have the clinicians, the clinical psychologists, the licensed social workers, the licensed professional counselors that have a spectrum of working. So when you look at the team and looking for contributions, be able to look at the variety across the spectrum to see what's best for your athletes. Sometimes it's a voice of somebody who's walked that walk with them. Sometimes it's a little bit more of a clinical presentation, or somebody who can help give you some insight into what they're motivated by and what the insights are to help them along that pathway. But I always think it's important to do a quick overview of the mental skills training paradigm. And I think there's valuable resources across each of those different levels to help you guide your athlete through their process mentally. But I will say, as we go into this, many times the training team, the athletic trainers, the sports medicine providers, and every part in between there are brilliant, and many times the best mental coaches that our athletes have in their recovery. They come to you first, and many times they're going to share something with you and be vulnerable with you much sooner than they will with me. So it's important that you enhance that listening and be aware and know the ups and downs that your athletes are going through. Tune in a little bit and express that empathy. They will share with you, and you'll be able to see patterns a lot more frequently than I will if I see them once a week. You're seeing them every day. And many times you can watch things such as their personal hygiene or the conversations they have with their loved ones. Are they coming in stressed and worried and trying to avoid versus sitting down and being open and having a dialogue? Trust your instincts there. And you're much more skilled in the mental side than you give yourself credit for. I think the athletic training staff is the number one conduit and gateway and window into many of the athletes' emotions. I'm a very big believer in empowering our athletic training staff and our strength and conditioning staff to be the eyes and feet on the ground, because the value that you bring is unquestioned. And it's so important from my perspective to trust those individuals to continue to deliver unbelievable service and care and humanity to these athletes. So kudos to you guys. All right, so one of the things that we see when an athlete gets injured, right, is an athlete all of a sudden goes from being a highly functioning athlete to, boom, in the heat of the moment, all of a sudden their function is gone. And whether it's a nagging injury like mine came on about a week before I realized the pain was significant, to somebody who has a tragic and catastrophic is what I would refer to as a loss of playing time type of injury, is that all of a sudden you went from a highly functioning, highly skilled, and really healthy individual to somebody who has a complete loss of function in a snap. And that can be very difficult. For many athletes, they've been almost infallible. They don't see themselves as struggling or weakened by any means. They're superpowers until they have their first injury. And an injury for me is the first place where I can really dive into understanding the psychology of the athlete. And what's brilliant is when you start to understand what makes them tick. It's a brilliant insight into their overall psychological disposition. So you'll hear things like, why is this happening to me? Almost the shock of an injury. How could this happen to me? I've always been an athlete. What am I supposed to do now? For many times, the injury is the first time that they have athletic mortality. What am I going to do when my athletic playing career is over? And the athletes that are replacing me, what are they going to do if they beat me out of my position and I lose my role? We've heard forever that an athlete should never lose their role due to injury. And yet Tom Brady, Dak Prescott, and many others have assumed the role of a starter and gone on to unbelievable careers because of the misfortune of an athlete that they were backing up. Am I still part of the team even though I'm hurt? I had this conversation yesterday with an athletic department and the head of the personnel with an athletic director of athletics at a college, because they said, what do we do with our athletes who then disengage in the classroom because they get hurt? They came here to play and, yes, to get an education. And we use education as the glue to keep us really going. What do we do if we get injured? And will I ever get back to the player I was before the injury? That was the question that I had. And it was very tough because I finally ascended to what I thought was what I was capable of, and to have it just completely taken away from me in essentially one night. And then I know I've been cleared to play, but what if I get hurt again? The fear of re-injury is real, and it's significant. So let's talk about one of the contributors. Now, when you look at an athlete who gets rolled up on in a football game, or a soccer player goes in for a tackle and feels a pop in the knee, how can that be any influence from stress? Well, there's been a variety of studies that have been done, and they're longitudinal studies where they assess prior to the start of the season levels of stress among their college athletes. And a lot of times when I'm going to be talking about college athletes. One is most professional organizations are not going to release their data. And most college organizations and athletic departments aren't going to release the data on their athletes either. So one thing you have to remember when we're talking about research, that among the psychological aspects of injury, is that the access to the big populations is very difficult. So we have to make some logical assumptions and rely more on clinical foresight maybe and experience than we would of hardcore data. And that's just an unfortunate nature, but it is a competitive environment. So stress. Stress is any influence placed upon us that requires us to make a demand and a response to it. Right? And stress, not all stress is bad. You can have the busiest day and be so excited and stay up all night because you're celebrating a championship, but the impact that it causes your body over the next few days can be stressful. And I know from many of my athletes that by the end of a season, they start getting ill, they start getting sick, sinus infections, upper respiratory infections, because their immune system is suppressed because of the amount of stress that they've taken on. And we know one of the biggest stressors you can put anyone through is to restrict their sleep. That's the definition of a college athlete, right? And even a professional athlete. So there's been a lot of efforts in the community over the last few years to work on the stress and the coping of our athletes. So they looked at these longitudinal studies where they assessed, particularly in a football team, who was going to get injured during the year. And one of the most robust predictors was the amount of stress that athlete endured prior to the season. Now, it's important to help you understand something. There's two types of stress. There's major stress, and then there's the culmination of minor stress. And the professor that I trained under was a specialist in minor life events, the little daily hassles that alone don't really cause much of a response from us. But when you start adding them up, the additive effect of sitting in traffic, worried about things in your life, and so on, build up. The demands of having to respond academically, the having to do press conferences, time demands, and so on, build up and wears us down. But for many of our college athletes who may not come from the best home life situations or most stable home life situations, and you add in the fact that for most psychological conditions, the blossoming age of psychological disruption is somewhere in the 18 to 22 range when you first leave home. That's a major life event, so moves can be significant. Many college athletes have children already, even at a very young age, and that's a massive stressor. Then you add in the financial pressures and the financial pressures of many of their families. Oh yeah, and then having to play on a large stage, regardless of the level of schooling, and play with a social media response that so many people are watching what they do and commenting and trolling it. All those different factors create stress. So when you look at an athlete, how does stress predict injury? Well, there's a model that Williams and Anderson from 1998 put out, and I think it's fantastic. Essentially, we have to understand that a stress response in our body happens both cognitively or psychophysiologically, as well as just overall physiologically. So we know that the stress response, the fight or flight response, the sympathetic nervous system is going to respond from a fight or flight response. It's going to gear up for the impending demand. Well, cognitively, mentally, we do the same thing. We see challenges and responses, and then we gear up. So you see more negative thoughts, fear, doubt, apprehension, worry, catastrophic thinking going on when people are under stress. So when you see the stress response, it's a natural humanistic response. It's an unfortunate miswiring of our system in today's world where we don't have the traditional primitive threats. But one of the biggest threats that we have to our overall system is our ego, our self-image. So when you see the stress injury model, we have a heightened stress response. What are the factors that can contribute to it? Well, you have a stressful athletic situation. You have a knee injury, you have chronic back pain, you have shoulder pain. If you're a gymnast, you have long-term nagging injuries in the end of your athletic career. And that enhances that stress response. Well, those are all modulated or moderated, buffered by your personality. If you have a personality that engages and works with others well and can cope and see the real world and see the horizon, you can put things in proper perspective. But imagine if your entire life is built around your athletic success and your whole self-identity is built around your value as an athlete. That's going to be a risk. Do you have a history of trauma or history of other athletic problems from an injury standpoint where you've struggled in the past? How have you handled stress and moving multiple times during your childhood? How do you deal with a split family if your parents are divorced and they're at each other's throats? And so that safe bond that you have to help you recover and cope may be gone because the way that you solve problems has been demonstrated to you in a family home where you argue and pretty much tear each other down. So the real big one is, how do we cope? How do we manage things? Well, unfortunately, some people cope with alcohol, drugs. Some people cope with avoidance. But other people can cope with spirituality, very powerful coping mechanism, active problem solving, getting engaged. So when we see these different factors with stress building up, we want to know how they cope. One of the biggest questions I ask when an athlete is injured is, when you've had major stress before, who do you turn to? What do you like to do when you need help? And for many, it may be calling a dear friend. It may be hanging out at the ballpark. And for many folks like me, the ballpark was not a stressor. It was a stress reliever. So when you got that taken away from you, wow, that can be difficult. And we're going to look at those underlying skills, like that biopsychosocial approach. How do you problem solve? What are your irrational beliefs? One of the biggest predictors I've seen of somebody is that they feel that it's unfair that they've been injured. And that's hard to cognitively process, the fact that I'm no longer, that the world is not fair. It's not just that I've been injured. I've done everything right, and why am I getting punished for doing everything right? So all this response, this injury model suggests that the stress response heightens. Well, physiologically, what happens when the stress response heightens, we go back to Psych 101 or basic biology, is that your visual field narrows. Your response times get locked in on different factors, and while they're fast, they're also more distracted. So if your visual field and your response times tend to be a little bit more variable, you may be a quarter second, hundredths of a second shy of moving your foot, and yet it gets rolled up on. You may not be able to plant your foot properly, and you roll or pop an ankle. And you have muscle tension and the like. Now, I'm not saying it's causing the injury, but it's not allowing you to have the best shock absorbers and the best system to navigate. So just something to think about. There is a lot more psychophysiological research and the psychoneuroimmunology research to show the impact of stress. For instance, we know that caregivers of breast cancer patients have higher risks of illness and other cardiac and more significant illnesses immediately post-recovery for the breast cancer survivor, or if they passed away from breast cancer, the caregivers have increased risk of illness. So there's things that we have to look at. Okay? So, boom, we have an injury. Wow, dramatic. We went from very, very active to now, wow, I've lost the function of what I need. And I've seen it firsthand. I've experienced firsthand what happens. The automatic shock moment happens. And I'm going to go through the phases. But we have to look at some of the different factors of recovery. Not only does stress predict injury, it also predicts a slowly rehabilitative process. So stress is a big issue. And now we're taking a major stressor, loss of function in your occupation, impairment, and increasing self-efficacy, self-belief. Do you believe that you can overcome this? An amazing predictor of recovery. But if they've never been through it before, how do they know if they can do it? Okay. Then we're going to look at motivation. What motivates them? Well, if their motivation is to get back on the field so they don't lose their job, that's different than being motivated to work on the weakened areas of the body and help strengthen. Locus of control. Do they believe they have an internal locus of control? Meaning, do they believe that they can influence their outcome? Or do they have an external locus of control? Which means that you are rehabilitating them. You are returning them to the field. An internal locus of control is a much better predictor than an external. We want them to have an internal locus of control about their belief in return to play and success in life, and an external locus of control on negative things that happen to them. I don't want them to have an internal locus of control for negative things. Therefore, they believe that they are responsible for everything negative that has happened to them. I love it when an athlete tells me that was just a very unlucky circumstance. I was in the wrong place at the right time and got injured. And then what social support do they have? And I'll talk about this a little bit more, but here's a key factor of social support. Social support is not about the number of people they have in their life. It's who they value the most. And it may be one person. or many times the rehabilitative staff is their social support. You guys are the ones that they turn to when they need it. And it's interesting to watch many times the bond and almost the dependency that the athlete has upon the athletic training staff, the physical therapist, the rehabilitative staff. And they find, I call them puppy dog. It's not the fact that they can't function without them. It's just you become their source of strength, and they request you, they want you to help them. They enjoy that time because they're getting one-on-one attention. And it doesn't mean that they're lacking it in other parts of life, but you bring them healing and support. So that social support that you provide can be very, very valuable. All these different factors contribute to adherence and success of the recovery process. And we, for many times, look at the injury rehabilitative process from a psychological perspective. It's like, they're tough people, they can overcome it. And we ignored many of these other factors. With all the high-profile cases of athletes that struggle, and we know the increased mental health burden that we're seeing among student athletes today, in the high school all the way through the professional ranks, particularly with regards to anxiety and some mild dysphoria or even depression, your role in looking at these psychological factors are critical. And I'll give you guys some very practical tools here in a little bit. So this led me to coming up and observing, having worked with athletes for many years and going through my own process, what I call the 5 phases of injury rehabilitation. It's an amazing marketing name, I know. A lot of focus groups. But really it helped me understand the pathway that an athlete goes through. I'm going to go through each of these phases, but let me just give you an overview. The first phase is the acute phase, right immediately post-injury, immediate post-awareness. And if you've ever had a significant injury, you know what's going on during that acute phase. It's an immediate adjustment and pain management. Then when you move out of that, you're immediately post being put back together, I guess you could say. You go into the limited ABLs phase. I really didn't know this process because when I had my shoulder injury, I just couldn't play basketball and I couldn't throw. But I didn't have a sling, I didn't have a locked in. When I had my left hip replaced over 2 years ago, this limited ABLs phase was the most struggled place that I had. I couldn't sleep. I couldn't lay on my left side, despite the fact that I could, physiologically or pain-wise, I couldn't. Getting up to go to the shower was a chore. To go to the restroom, I had to plan my day around when I was going to get up and go to the bathroom. What feels like something you took for granted before injury. Now, I remember the occupational therapist coming into my hospital room and showing me how to use a stick to put my socks on. And I remember telling the OT, I said, I know this sounds callous, but I'm not going to go anywhere without my wife taking me and she can put my socks on. But it hit me. I can't imagine if I was living by myself and had to use the stick to put a sock on. That's how much you go from feeling valued and purposeful to being completely restricted in life. Then you move to the limited functioning phase, which I'll come back to later, and then the active rehab. And then guess what? After you go through the active rehab, yay, you're done. You're returned to competition. Wrong. It's just getting started all over again. So let's dive into the phases of injury rehabilitation. The acute phase. The acute phase is the immediate loss of physical function. It's the moment of injury to the point of no longer doing wound care, predominant wound care. So if somebody's had a significant ankle injury, this is a very high-profile case of a young man who had a tib-fib fracture and dislocated ankle. That immediate phase and an immediate response of being highly functional within a minute to go into a point where your foot's pointing in the wrong direction. Now, one thing I want you guys to understand, when I'm talking about injury rehabilitation, I'm going to take out concussion. Concussion is its own pathway, and I actually refer to an expert. One of my experts is a gentleman by the name of Dr. Joe Ackerson. I refer to him in pretty much 100% of the time in concussion because that's his expertise. So I'm going to take that off the boat right now. But the acute phase, one of the things that we have to be aware of is pain and discomfort. And there's a lot of misinformation because of the opiate abuse epidemic in the United States, but you have to help patients understand how to manage their pain. And I'm not going to go into a lot of detail, but in the chronic pain world, PRN medication versus scheduled pain medicine. I know for me, I didn't want to take anything because I was afraid of being addicted. I know that I like the feeling of relaxing by taking a pain medicine. I'm not saying that in a negative way. I take it, and I call it the blanket of love that would come over me when I would take one of the pain medicines. So I limited very strongly, but that limited my ability to do physical therapy. So talking to the medical provider and the surgeon, or the treatments, the medical providing staff, to help understand what is appropriate and not, so you can educate your student athlete on what is appropriate and what is not. Many times they may have a history of addiction in their family and they're afraid. I've had parents call me and afraid their kids are going to be addicted on Advil. So please don't assume that they have an understanding of how to manage the pain and discomfort. It can go as far as what is the proper schedule for ice or heat or whatever your modality is, to how do you brace the body during this acute phase to sleep? How do you self-care? What is appropriate to shower or not shower? What do you need to eat? Well, if they're taking medicine or they're immediate post-injury, what is their diet and appetite going to be? Psychologically, we're looking at their immediate concern over returning recovery. And for many athletes, like I said, they go from being very prominent in their university or their school to being removed. And it's a very unique place because they haven't been prepared for that level of disruption and almost withdrawal from their social network groups. So what happens during this time is that there's a very heightened social support response. I've seen many times that athletes will come and group around the injured athlete in the training room to give them support because they know that they're tough. I saw a very cool case where a student athlete was 2 days post-op of an ACL reconstruction, and an athlete that I was working with was in the return to competition phase, walked over and just hugged that athlete. And both of the athletes cried because they knew what they were going through. And that's a special bond. There's an old Sports Illustrated article where they showed the Tommy John injuries that pitchers in Major League Baseball have, and how they tattoo them up and have different markings to symbolize what they've been through. So in that immediate loss of function, the athlete many times defines their role and their identity around their athletic pursuits or their abilities. That's gone. So we need to look at that identity disruption. Now, early on, it's going to be mediated by the support. But my goal during this time is to reduce their pain and their overall distress. I don't want them psychologically trying to look ahead and predict what the future is going to be. What I tell them is, right now, we need you all in. It's like driving through a thunderstorm. We don't need to turn on our bright lights. We don't need to turn up our radio and get on our cell phone. Right now, we need to eliminate as many distractions as we can and be fully invested in taking care of the acute phase. This is the time where I need all hands on deck to help them manage. A lot of education of family, keeping in touch with them, calling their mom and dad, and educate them on what they're going through. Obviously per HIPAA, and you know those rules, but we need to educate. We can't assume that everybody has those answers, okay? I've sat in many stadiums and watched the family members watch their son or daughter laying on the turf, and the fear and the apprehension that they have because they can't get the information immediately. We got to remember, in a family dynamic, these are the people they love the most, and they're their biggest fans, and they're losing that identity too. So the more you can educate them during this time, the more powerful it's going to be. Once we move out of the acute phase, well, before we move out of the acute phase, I jumped ahead for a second, like our athletes often do in the acute phase. You have to manage a couple things. One is some negative thoughts that they have. Why did this happen to me? What did I do wrong? I didn't deserve this. And then they're going to second guess how it happened. What they did wrong. Was it a cheap shot? Was it should they have taken on the play? I've heard it a lot in soccer. I shouldn't have taken on that tackle. Will I ever get back to where I was before? I don't think I will, because I was so, I've never had to go. I'm running out of eligibility, or the draft is coming up, or my professional opportunities are coming up. And then, am I supposed to feel this way? Immediately post hip replacement, I thought I tore my ACL. And it wasn't until I called a colleague of mine whose dad had gone through something very similar that he said, no. He thought the same thing. It helps to have somebody who's walked that with you. But productive thoughts, is we're going to get through this together, okay? We're going to build something better, that I can handle this. I always challenge my injured athletes that if we ever got re-injured, if you ever did, you will get through this. So when they're sitting in that position, I remind them, remember, we said we're going to feel this. We got this. There's nothing that nothing that will break you. You can handle, right? I'm not a big fan of them trying to beat the time frame, but they all do in their mind. They all think 6 to 8 weeks means 4. So sometimes some rational relevant communication to help them manage that is very important. And you know what? I've done this before. And you can remind them as a provider, I've done this before. I've seen a lot of folks in the position that you're in. I've got a great track record of getting patients back. So let's do this together. Then after the acute phase, we move into the limited ADL phase. Now, obviously, that means activities of daily living. And there is a significant impairment during this phase. You know, going to class can be very difficult for a college or high school athlete. As a professional, they may have to have somebody drive them to the park. As a high schooler, right, you got to look at who's going to drive them to rehab and how are they going to get there. We're fortunate where I live in Birmingham, Alabama, where my kids went to high school. They actually have a physical therapy office in the high school. It was a brilliant marketing play by a physical therapy group because they know the patient population is right there and they could do it during their off time. Many high schools don't have that opportunity. College, when do they need to go in? Well, if they practice in the afternoon, most of the athletic training staff is with the team out on the field. So who's going to do the training and the rehabilitation during that time? So you have to find other times. But this is a time when they need more support. Getting up and using the restroom is a challenge. Helping them get food, helping them understand how to clean themselves. And I know that sounds crazy, but it's easier to skip a day or two of showers and not realize the impact that comes on your physical hygiene and your personal hygiene. So helping them understand the value of taking a shower during that time and not getting the wound upset. If you've got pain, you know, during this phase, it can be very difficult. I remember during this phase, I had a walker post my hip replacement, and we'd go to, I just wanted to get out of the house so bad after 7 days. And we went to a local restaurant, and it was raining, and I was scared to death to walk in the restaurant because I was afraid to fall and hurt my hip. Little things that you just don't expect build up in your mind and take over. During this phase, sleep disruption is a height, okay? They don't sleep very well. If you have a knee brace on, you can't bend your knee and it's rubbing against your other leg. If you have a shoulder injury, God knows, you know, you got the shoulder cranked out to the side or an elbow and you can't turn and move, and you find yourself really not sleeping well, and you sleep in bursts of 2 to 3 hours before your body wears out in that zone. Sometimes athletes will rely on sleep medicine or other things to help them during this time, which I would not recommend. But helping them find and build a sleep alternative is healthy. Even how to sit up in a chair and prop themselves up can help. Okay? Many times during this limited ADL phase, their family's gone back home. If they're in college, they couldn't stick around because they have lives and jobs. So now they're isolated. And that's a very scary place for them to be. You need to encourage them to help them find what works for them and what doesn't. So we're going to focus a lot of our rehab here on post-injury recovery and focusing on accepting the role they're in at this moment and helping them understand and even saying, yes, you're injured. Yes, you're going through the recovery process. I don't try to sugarcoat anything during this time. They psychologically can handle it. But one thing you have to remember is with sleep disruption often comes dysphoria. It'll mimic and look a lot like depressed mood, so you have to evaluate them for depression. Now, the depression may be completely circumstantial or completely related to the injury, but that doesn't mean that they're not feeling the pains that go with it. So I want to encourage you to talk to them about, hey, you might feel isolated from your team or withdrawn. You might feel down and depressed. Talk to me. Let me help you. If you need some help, we'll intensify our time together. One of the best things you can do for an athlete in this phase is get them outside in the sun and let them take in some of that vitamin D that we love so much. But just simply the energy that comes out of it. So a lot of times I'll have them go out to practice and stand or sit so they can watch. And just even though they're going to feel a little isolated, they can watch and see because social isolation is highest at this phase. The acute phase social response is now gone, right? They've moved on from it. So what I want them to do is stay around the team as much as they can. And I may find a role for them to play, whether it's breaking down film or sitting in the press box if possible. I can't stand, but I understand the limitation, particularly for small budget teams, about traveling an injured athlete. But if it's at all possible, particularly an athlete that's been a valued contributor and a core component of the team, I highly recommend you travel them. That will help them manage their process, okay? During this phase, it's very common for them to start romanticizing and anchoring into their past injury, pre-injury abilities. I used to never have pain. I used to feel great. I was going to be an All-American. I was playing out of my mind. And while they may have, what's happening is they're romanticizing because they have an absence right now. And so the best way they can do it, the future is so uncertain, is to romanticize the past. So we want to normalize the condition they're in. Now, what this slide shows is just a little psychological trick about which circle is smaller, the blue one on the left or the blue one on the right. Well, they're actual same size, but the circumstances around them will change their vision and their optics. You've got to be more effective and help them see the circumstances around themselves to help them build their future. Now, what happens is after an individual starts having some return of their ADLs, they start feeling better, particularly when they get a night or two of good sleep. It's amazing the energy return. All of a sudden, they can now move their leg, or they're not locked in on their arm anymore. And so they move into the limited functioning phase. Now, what I mean by this is that the limited phase means they look like a regular human, but they can't function athletically. They're able to walk to class, and nobody can really tell that they need additional assistance and the like. So the mental trap here is that they have improved general overall fitness, but functionally, as an athlete, they're still very impaired. The psychological adjustment during this period is to help them adhere and stay patient in their rehabilitative path. Patients love to see fast progress. We are not patient human beings. We love to push the envelope, but they don't always understand the true metrics. I'll tell you a story about that in a minute. So they question their long-term identity. Now they're 6 to 8 weeks removed from the injury. Life is somewhat returned back to normal, but they're still isolated from the team, and they may be questioning their career path or their overall ability path. You've got to remember, for some athletes who have professional sports aspirations, the family has built an identity around them, and they've talked about that. Much like somebody going to med school or law school, the family romanticizes that. And so your athlete may have an increased burden and responsibility there. And you need to talk to them about that. Hey, do other people put pressure on you to perform? They may not enjoy the sport as much as we think they do, but they know they're good at it. And we have to be very, very careful of isolation and depression during this phase, because they're more and more isolated and they're away from their regular routines. So we have to manage their expectations. The limited phase doesn't last that long, because what happens is after a little bit, we move into the rehabilitative phase. But during this limited phase, what I want you to do is lay out goals with them. Look to see what may prevent them. What's the obstacle? And then what's the behavior? Okay? So as an athlete, you want to help them and align everything that we're doing. And so you want to talk to them about what are the goals, what are the things that may step in your way, and what behaviors can you put in place. And it's a very effective tool that Alexander Cohen had come up with many years ago. Now we move into the functional rehabilitative phase. This is where players start getting excited. They start getting to do things that look like their sport, albeit it may be with a 2-pound weight. But the physical return to function gets started, and they must be patient to plan and not overdo. I know many athletes, if you put a 5-pound weight in front of them, they're thinking, can we 10 times that here? Because I used to do 50-pound curls. Now you're asking me to do a 5-pound weight? Well, they don't remember what they're not able to do, and their mindset is always pushed on go, 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 not being patient about what it takes. So anchoring to the past can intensify during this phase. They start comparing. I can't do anything now. And I used to be able to walk and cut. And, there is an old saying that an ACL reconstruction in a football player takes a year after return. A Tommy John injury takes a year after return. An ACL in a soccer player takes a year after the return. And what that means is the return for them to go free and not think about it. We're going to talk about that in the competition phase. So fear of function can be big. Also, they have a very skewed perception of injury pain and pain, soreness. And the soreness that they feel is very reflective and representative of injury pain. Why wouldn't it be? If you were driving through an intersection and you got plowed over by a dump truck, don't you think every time you drove through that intersection, you'd have a psychological response? Of course you would. Even if it wasn't the same time of day or even the same intersection. You'd be much more protective. So during this rehabilitative phase, they have to be aware of what normal soreness is. And they're going to be sore in areas, as you know, that they never have been sore before. But because they're using muscles in a more targeted and strategic way that you're putting them through, is slowing them down. They're going to get excited beyond measure initially when it just explodes with success. And then they're going to get very down when 4 days later, they look like those indicators are coming backwards. What they don't understand is sometimes we surge, regress, surge again. So what I have all my health providers do is visually chart their progress to help blast their misperceptions. If we allow our emotion to dictate where we are in our rehabilitative paths, we're always going to be frustrated. So I want to chart them. I want to give tangible outputs. I want to educate them. Show them what they're doing. Show them over time. Hey, you know what? 6 weeks ago, you were here. Now your range of motion is out here. It's a dramatic shift. I know you don't feel like you've made as much progress today, but it's funny how our mind plays with us. I have a patient right now who was threatened to be retired from their sport. Didn't think they'd ever be able to play again. And was able to rehabilitate back to a place where they can compete again. And when this person came to see me recently, he was frustrated that it wasn't going fast enough and he wasn't good enough yet. Despite the fact that a year ago, this person said, I'd do anything just to compete again. We change our perceptions constantly. We unfortunately look at the past and the future during this phase with a lot of scorn and uncertainty. The past and the future is a problem for these athletes. We have to get them present focused to win the rehabilitating and recovery pathway. And then the return to competition phase. Now, this is an individual that I love to talk about. And he's an athlete in the NFL now. And he was the gentleman that I showed you that was laying on the field with the tib fib fracture. And it's a very high-profile case. And he returned to play and broke his forearm right before he went into the national title game. The Alabama training staff is remarkable. The medical team is world renowned. And they were able to get him back. And he scored the winning touchdown on a kickoff return. And there's a brilliant Sports Illustrated cover with him that signed in my office with his surgeon jumping up for joy behind him. That's the value. But when we return to competition, a couple things happen, right? Is that players are not in game shape. They may be in shape. I've had an athlete come back all upset that their coach said they weren't in shape. What the coach was saying is, you're not in game shape. 2 minutes on the basketball court feels a lot different in a game than 2 minutes doing drills on the court. So they have to build up that psychological and the physical endurance again. And they move them from game shape to getting them out in the core of competition with not having to be primarily focused on the injury. What I find is athletes during this phase become very good checkers and testers of their injury. They wake up every morning testing their knee or their arm. I used to sit in class when I had an elbow strain, and I'd pull on the bill of my hat to see if my elbow would hurt. I would do that at 9 o'clock in the morning to see if it would hurt at 3 o'clock in the afternoon during practice. So when you see those types of things, I want to move them from getting them in game shape to competing with still some focus on the injury. I can't get rid of their focus on their injury. To then competing with freedom. And that freedom is that they can compete without testing. A soccer player can run in and go for a tackle and get up and run without even thinking about their knee anymore. A basketball player can jump and not worry about the pain of their foot when they land. And when they do that, they realize, ooh, I've come a long way. Unfortunately, for many of our coaches, we hear, Coach, they're cleared to return to play. You have to monitor and you have to pretty much negotiate for the athlete what's an appropriate return to competition is. Because we got to focus on some minor progresses there, and we have to manage the fear of re-injury, the tension, the frustration that pops in. We had an athlete one time, many years ago, who, despite all the psychophysiological and performance data, didn't see that they were healthy because of the graft until they were able to go up steps without pain. And what was funny was he didn't realize that the steps were not an issue anymore until he came in one day and goes, unbelievable, I was able to go up steps without any pain. I know I'm back. And it was funny, we had all this data that showed him that they were better now than they were pre-injury. But the weird thing was he was assigning it to going up and down stairs. And in his mind, that was the evaluation of whether he was healthy or not. So what I want you to do is understand that it's not always logical in return to competition. It's a lot of times somewhat superstitious or illogical. But if you talk to them, they'll tell you these things. And then you can grow on them and build on them and help them build their mastery and success of what they're doing. All right. So during this phase, I do two things. The first thing I do is I have them assess on a regular basis on a scale of 1 to 100 what they are. I have them put it in their iPhone calendar. Today, on a scale of 1 to 100, 100 being the greatest you've ever felt, and 0 being the day after surgery, tell me where you are today. Well, I'm at 62%. Awesome. You're 60, and I usually start this in the rehabilitative phase, but I'm really working it in the return to play phase. They're never going to be 100%. And what I try to tell them is, you're an athlete. You'll never be free of pain. It's just the experience. Now, that may be true or not true, but what I'm trying to do is get them to not think that perfect is their goal. Functional is their goal. So when somebody's about at 80%, I know that they're ready to go out and go at it. They will tell you, they will be honest. If you ask scale of 1 to 100, what are you? A visual analog scale like that is one of the most predictive factors of success that we have in the psychological literature. It's amazing. We can design all the greatest research there is. You ask somebody to rate their performance on a scale of 1 to 10 or 1 to 100, they're amazingly good at it. And just chart it, have them chart it. And you say, look, today you're at a 70, but we did some real, you got back out on the field and you played a half of an inter-squad game. And so today you're at a 70. That's really good. This time last month, you were at a 47. So let's look at the difference and why you're hurting today. You've made such significant progress. Then I want them to assess every day. 3 things that you did well today, 3 areas that you struggled, and 3 ways that you're going to improve going forward. The reason I'm doing this is I'm wanting them to take ownership of the rehabilitative course and also to not choke, but to develop some sort of relationship about being a very active monitor of their rehabilitative course. All right, practical suggestions for the treatment team, coaches, everybody in between. Establish trust by demonstrating credibility and building relationship. There is a calming component. Don't lie about it. But there's a calming component to say, you know, I've worked with a lot of athletes that are in the situation you are in right now. I'm going to navigate. I'm going to be your guide. I'm going to walk this path with you. I'm available to you when you need me. I've seen this before. You know, a lot of times an athlete is having weird feelings and thinks that they're the only ones. Like me, I thought I tore my ACL. Couldn't figure out how. I didn't realize how brutal a hip surgery was. I knew it was bad. I wouldn't watch it. But I didn't think they were going to do that to my knee. Okay, so you got to establish trust by demonstrating that credibility and building the relationship. One thing I always tell providers to do is when you got to give them or have a really significant conversation with them, sit down at nearly their eye level. When you need to demonstrate authority and credibility, stand up. So you're a little bit physically higher than them, not imposing on them, not bowing up on them, but just if you need to establish credibility, stand up and be strong. But if you need to go at an empathetic level, sink down to their level and look them in the eyes. Now, historically, and we got to be careful here about touching, particularly male, female, male, or whatever, it is that touching can sometimes be very effective. And even if you say, hey, can I put my hand on your shoulder for a second? I just want to let you know that I've got you. Now, I'm going to leave that up to you because I know that certain circumstances that can be misconstrued. So I'm not suggesting anything inappropriate there. What I'm saying is sometimes just even when you shake their hand, putting your hand around and say, I got you on this, okay? That can be that physical touch can create a connection. Help athletes look at the current and future function instead of anchoring the past. Hey, look, we're going to do this. We're going to work. They are going to look for examples throughout their sporting life to try to look for positive examples that have been able to navigate the injury. So identify with them which ones that they can do. Aid the athletes in developing a role throughout the recovery process with the team. Get them to get involved with the coaches, whether it's going out to practice and charting plays, it's breaking down film, or helping a younger player succeed. It's really, really powerful. Assist in expectation management by helping them set realistic and attainable goals, and then increase the engagement throughout the process by giving them choices. All right, so let me explain. I call it sandboxing. You know, when you have kids and you want to take them to the playground, you don't usually let them choose which playground they're going to. You choose that as the parent, but you let them choose what apparatus they can play on. It gives them a sense of control and involvement. What I tell athletic trainers and the medical staff is ask them, what time of day do you like to rehab? What time do you like to come in? For me, getting up at 6 o'clock in the morning when we had games till 10:30 at night, that was punishing. So if you had asked me to come in at 6 o'clock at night, I would have been very happy to do it. I didn't mind going in late. Okay. Now, as I'm older, I'd much rather go early. But ask them, negotiate with them, but then hold them accountable to what they chose. But don't give them free reign. Give them a spectrum. Give them the perception of control, because at this phase in their life, they probably have lost a little bit of the control that they have. Remember, you're already doing most of these things. You're amazing healers. You're support folks. You're helping, guiding them along their journey. And for many of you, you're leading the way. They rely on you. Show them the way. Okay, so what? Now what do we do? I just went over the 5 phases, right? And what I decided to do, the reason I decided to do this is I believe strongly enough in this process that we did our entire online course. It's about, I want to say maybe 20 videos on each of these different factors and things that you can do. So what I've decided to do is the exact same system I've worked across the board in a lot of different places. Is I'm going to make it available to you. Now, this is a free webinar. There's no hook. You don't have to buy this. But if you want to, it'll help you. I wish we had the CEs for it. Right now, we don't, but we're working on it. It's called Cleared to Play, and it's the phases of psychological rehab in sports. It's a great thing for schools, organizations, and all the way through. Every coach, I think, should go through this to understand the psychological side. The statements that we make during this phase are critically important. It's available to you now. It's the offer is available on the screen. I highly recommend it. I believe in it strongly, and it's what's guided me in everything I've done. Right? So it's 16 online modules. That's what it is. Deeper dive into the 5 phases. It's resiliency and grit, returning from injury, manage the athlete's identity, the psychological factors that lead to injury, how we manage resistance, and then empower adherence, and then the biopsychosocial model for pain and rehabilitative medicine. Okay, so how much is it? So it's normally $350 through this program, and coming on this free webinar, it's only $97. Listen, whether it has CEs or not, it doesn't matter. Anytime that you can learn about the psychology of an athlete, you're going to be better. There's unbelievable resources available to you. You can email me and go, and let me see how to make this thing live. I think it's somewhere on here. Well, it's on here. I'll make it live, though. So we're working on it. So we'll go and make it work, and you'll have this available to you. So let's see, I was getting a message. Somebody said it wasn't live on here, but I'm clicking it and it's saying live. Okay, it's good now. Now it's live. There we go. Live, live on Saturday night, right? Okay, so that's the value. It's $97. I highly recommend it. I'm not a big sales pitch guy, but I believe in this product. I believe in this content, and I believe that the psychological rehabilitation of injury is one of the most important factors that we can have. We know the value of physical rehab. We know what it takes to get the knee back. We know the science behind it, but we're just really diving in with some amazing research and colleagues of mine in the psychological literature on the psychology of injury. Let's continue to dive in and make these athletes better and make them not see an injury as a defining moment in their career, but most importantly, a developmental phase to help them find who they are. All right, so how you do it, we're going to click in this little phase right here. You're going to click Add to Cart on the button if you want to buy it. It's available for the next 90 minutes. Enter your payment information, your username, all the information that goes with it. You'll create your username and password, and you'll have 24/7 on-demand access to all the video content. And when you do that, you can click on Training Center, and it'll take you and get started right there. Super easy, super cool, super fun. Okay? I want to thank you for your time tonight. I kept it right at an hour. I'm always trying to improve the way I do things, and I want to deliver better content. This is something I'm passionate about. I do many grand rounds across the country on the psychology of rehab. If I can ever be of help to you, please visit us at brettmccabe.com. Follow me on social. How many of you found us at Dr. Brett McCabe in a variety of different settings. You guys are the best. I want to thank you for continuing to impact thank you for all the impact that you make on your patients' lives, and more importantly, getting our athletes back to enjoying the game that means so much to me and to them and their families and to you. Ultimately, we're in a competitive environment, but most importantly, we're in the environment of developing better humans. So thank you. If there are any questions, you can ask me in the chat. I'll be around for a few minutes. What about the free PDF? You should be able to get a email being sent to you that will give you the free PDF. And if you don't, send me a message. If for some reason there's a hiccup in the system, we'll get that out to you, Lane. So thank you. It'll be the free PDF will be in your email. Are there any other questions? I'll stick around for a few minutes and answer anything that may come your way. Thank you, Brandon. I appreciate it. Hopefully this was helpful. And with that, I'm going to end this teleconference and this webinar. Please send any messages you guys have and what we can do better. Thank you very much. Thank you, Keith.